child, what the mother should be expecting from the child. How can the mother recognize my child has been infected with diphtheria?
Oh, thank you very much for that. So diphtheria, the respiratory diphtheria comes down with respiratory symptoms like runny nose. So there will be mucus, which is unilateral. It is located on one side of the nose. It can be on the left side or the right side of the nose. So depending on the area, so it is always unilateral. It is always secluded to just an area. So there will be presence of a crust at the lateral parts or at the side of the nose, which is yellowish in color. So the child might have sore throats. The child might have difficulty in swallowing in progressive stage. The child might have difficulty in breathing, also in progressive states. Also fever. But there's a classical sign that parents should watch out for in their children. Once they see a membrane or a covering at the back end or at the end of the tongue, they should act fast, because that is like 80% certain that it is diphtheria. Though the diagnosis is majorly clinical, the child needs to be taken to the hospital for the appropriate health personnel to see the child and diagnose it to be diphtheria. But once you see signs like fever, sore throat, runny nose, which is on the side with mucus that is yellowish in color and crust at the side of the nose, then difficulty in swallowing, difficulty in breathing, then a membrane covering the end of the tongue downwards, which is yellowish in color, the parent should act fast and take the child to the necessary health facilities, because it is highly suggestive of diphtheria. So the skin or the cutaneous diphtheria comes down with wounds that are circular and also yellowish in color around the wounds. There will be a yellowish discoloration around the wounds. So those are suggestive of cutaneous or skin diphtheria.
Okay. Can you bring about something like swelling around any part of the body?
Yes. There's a popular thing in diphtheria that they call a bull neck. That is, the neck will be swollen. And
like bull?
Yeah, like bull.
Okay.
So the neck will be swollen. And what causes this swelling? This swelling is due to the reaction of the body.
Okay.
Once an infection